Hi. Um, this week's assignment has to do with examining neurocognitive disorders. A neurocognitive disorder can be defined as an impairment of cognitions that may include memory, vision, language, reasoning tasks or skills, and attention, to name a few. Neurocognitive impairments can cause mental deterioration and mental illness, and affects the person that's dealing with it, their quality of life, and also their physical and emotional health as well. Some examples, of neurocognitive disorders are Alzheimer's disorder or disease, dementia, any kind of traumatic brain injury, and also Parkinson's, I read, is also a form of a neurocognitive disorder. Any of these neurocognitive disorders, I think as a therapist, we have to understand they're going to cross over into a lot of other disorders. For example, depression. Obviously, that would be one that's really high in comorbidity because if you can't remember, then obviously that's a cause of frustration. If you knew that you put something somewhere and then you can't even recall where you put it, that's a cause for frustration. So I can see how someone would get depressed about that. Also anxiety, not being able to remember a family member, a close family member, that's really cause for a lot of anxiety of, will I ever get my memory back? Am I going to get any worse? These are questions that our clients may be asking themselves, and just not being able to take care of oneself or be independent. I think that's the cause for depression, and it's the cause for anxiety for a lot of clients dealing with dementia and Alzheimer's. So this assignment asks us, the students, to find out information on existing supporting services in our area for patients suffering from a neurocognitive disorder, and the resource should provide the following: the type of resource, targeting group, specific services, who is facilitating the group, and the time and location of the support service. Well, I will say that in finding this information out, I found a lot of information. I can show you a stack of papers that I printed out that will help someone that's suffering from any sort of neurocognitive disorder. I think as therapists, we have to kind of meet the client where they live, so to speak, in that we don't know how far along into their disorder they are. We don't know how supportive their family is, even if they have family around. So I think we have to take all those sorts of things into consideration, and we also have to be empathetic to what they're going through. Because just me in my normal self, I'll say sometimes when I can't remember, when I can't find the words to express myself, it's frustrating. So I can only imagine a disorder that is degenerative over time, and it's progressive. It doesn't get any better. I think that if you catch it early enough, you can kind of do things to prolong, I guess, the inevitable, so to speak. But it is something that's going to carry on with them throughout their lives. So we have to be really cognizant of that, and we also have to be empathetic to the client's needs. So I imagine that my client had Alzheimer's disease, and they're in a pretty early stage of it. I imagine that since I work at Emory Healthcare, I'm a nurse there, and I do actually encounter a lot of clients that are in the very early stages of Alzheimer's disease. So I'll say that my client is a 62-year-old man, and he's in the hospital for a hip fracture, but his daughter is caring for him and would like information about Alzheimer's disease. Well, since I am a licensed marriage and family therapist, I'm also going to be acting as a case manager, and I'm going to look in my area, or rather their area. They live in Sandy Springs. So she is looking for a support group for her father. So I go around and I Google Sandy Springs support groups for Alzheimer's clients. So actually what I came up with, Emory is one of the leading hospitals that does a lot of research about Alzheimer's. So I would lead her in that direction, and I know that they have a lot of support groups, not only for the families, not only for the clients, but for the families as well. So I actually called the memory clinic. Let me actually get that paper. I actually called the memory clinic, and they're open Monday through Friday from 8:30 to 5. And they accept most insurances. And I asked the young lady, if the client couldn't pay, if they didn't have any insurance, would they still be able to be seen? And she said yes, that there was a $500 deposit, and this is at Emory, mind you. It's a $500 deposit, and that will take care of lab costs. It will also take care of assessment costs. And once that $500 is taken, the client will be able to be seen. Now, if that's too expensive for the client and their families, then I will also suggest to go to the local DFACS office, which I also looked that up, and here's a big stack of papers. And the Department of Family and Children Services actually has a whole area just dedicated to persons that are older. It's called the Fulton County Office of Aging, and they provide services like transportation, adult daycare, home delivered meals, neighborhood senior center, volunteer services, senior multi-purpose facilities, and advocacy. So this is also a great resource for persons that are dealing with neurocognitive disorders, because that'll kind of point the family or the patient in the right direction of finding out more information about their illness. Also, I will say the Alzheimer's Association, that's the national association, can expedite the process of maybe putting somebody that's a little further along in their Alzheimer's into a facility that specializes in neurocognitive disorders. So that's a really good resource, and also it's very streamlined. It'll ask you what state you live in, and then it'll go on down to the city and the county that you live in. So that's a really good tool to use. So like I said, just going back, a lot of different places have support groups, not only for the person that's suffering from Alzheimer's, dementia, whatever neurocognitive disorder, but they also have support groups for families as well, because it is it does affect the family as well. Just seeing your loved one hurting or frustrated makes I would think would make them frustrated as well. So I checked the one in the Atlanta area, and they hold actually one at Emory University, and it's held twice monthly. And this is a support group, not only for the patient but for the family as well. And that support group is an hour and a half long. It's from 6 to 7:30 p.m. and it's held at the main campus at Emory University. And they also have an 800 number that the client or their families can call if they're not able to physically make it to the support group, which I think that's awesome. So, of course, the targeted group, again, that's just really up to you. If it's the client can attend the support group. If it's a family member and they need support, there's support groups for family members. What specific services? Really, I think the groups will kind of let the patient the client or their family know what's available to them in their area. It's just really about them meaning the family member or the patient trying to find out that information. So there's a lot of support groups, and like I said, if you want to kind of go over that and just go to the national level, you can do that and work your way down. Who's facilitating the groups? I can speak for Emory and say it's a lot of nurses and specially trained personnel that specifically work with clients that are suffering from dementia and Alzheimer's disease. Also, the persons that run the support groups normally are psychiatrists, psychologists, and also licensed counselors that specify in neurocognitive disorders. The time and location, again, like I said, for Emory, they hold their meetings twice monthly. The meetings are the support groups are an hour and a half long, and they're at the main campus at Emory University on Clifton Road, and they're from 6 p.m. to 7:30 p.m. And also, if the client cannot make the actual physical support group, then they're able to phone in at an 800 number and able to have a conference call, and they're able to get that information that way. If I will say, if the client is able to call, they maybe have a cell phone. If they have a computer, that's great. Like I said, they can also use Google, and put in whatever they feel is pertinent to them. But again, you also have to factor in how far along in their illness they are. Will they remember what they've searched? Do they have a supportive family? And I would say, if not, then we meaning the clinicians, would have to be their ears, their memory, and we would have to help them as best we can and provide them with the services that are going to, help them to lead their best lives. So that is it. And that's my examination of neurocognitive disorders and how we can help clients that are suffering from them. Thank you.